Hello, welcome back to our series, The 4 Steps to Sustaining Improvement in Healthcare. So let's move on to step 2. Focus on the patient, not the metric. Now again, I want to stress that metrics are important. Not only are most of us lean practitioners who know this to be true, but many of us are also clinicians trained in the scientific method. Measurement has always been an inherent component of our work. But in most organizations, we created improvement teams specifically to address a particular metric or set of metrics rather than in response to patient needs. Think of how this evolved. We all started our focus on metrics when core measures were introduced in 2001 because we knew that our results would soon have to be reported to the public. And as new core measures, IHI collaboratives, disease-specific certifications, and HCAHPS were introduced, we layered on even more improvement teams, focused specifically on the metric that each program required us to improve. Hence the overwhelming number of committees and project teams that we discussed in step 1. Now, most organizations today have a mission, a vision, or a service statement that says that patient and family-centered care is a core value in your institution. But our reality is that care remains much more clinician-centered than patient-centered. There's been a tremendous focus on patient experience for the past 10 years, but that's not the same thing as patient-centered care. A true culture that focuses on the needs of the patient and family must be embedded into every level of the organization, including your improvement system. So let's talk about 2 strategies that can help you to change your improvement focus to be on the patient. The first strategy is to do an organization-wide assessment of your current patient and family-centered care culture. There are a few tools that are available online that can help you with this, but I found that the best one is from the Institute for Healthcare Improvement. It's free and it can be easily found on the IHI website. Now this tool will walk you through an assessment of all levels of your organization, and it helps you to quantify where you are on a scale from 1 to 5. The IHI recommends that you complete this assessment with various groups, from patient advisors in the front line to your physicians and executive teams. Now, in my experience, it's quite eye-opening to see the difference in how these groups view how patient, family, and family-centered your culture really is. So the second strategy is to think holistically about your improvement structure, meaning consider combining your improvement teams so that they focus on similar patient populations. Now, it might be easier for you to visualize this if you think about the stakeholders that need to be involved. For example, think about all of the teams that you have that are focused on some problem or disease process that's related to either oxygenation or ventilation. Think COPD, pneumonia, influenza, VAP, and so on. It's likely that you've got nursing, infection control, pulmonologist, respiratory therapy, someone from quality and IT, and a whole bunch of others on each of your teams. By combining their efforts into a single group focused on all of these patient populations, you can reduce the number of meetings that they're required to attend, making your improvement work more efficient and interdisciplinary and less costly. Of course, this is not as simple as I'm making it seem right now, because in my experience, everybody always agrees that there are too many committees and that we should better align our efforts. But they also think that the committees that should be eliminated belong to everybody else for them. So getting buy-in from every leader is critical. And of course, as is true for each of these 4 steps, this work must be driven by the CEO and the executive team. So I hope this information is helpful. Again, please feel free to reach out to us if we can help you to assess patient and family-centered care in your organization, or to implement strategies such as aligning your improvement system to focus on the needs of the patient. You can schedule a call on our website. And please keep listening if you'd like to learn more about the next step in simplifying your improvement system. Make it easy for the front line to know what to do.